Welcome everybody to WASHA's third webinar. Thanks so much for joining us today. I'm Ingrid Nielsen, Chair of the Education Committee, and I'll be facilitating the webinar today. As you see here, our vision at WASHA is to revolutionize how people view their health by transforming patients into empowered and active partners in their health care. So if you want to learn more about WASHA, just please visit our website at washa.org. Today, we're going to discuss a timely topic, given that open enrollment for Medicare starts in October. And our speaker, Dianne Walkup, will talk about understanding Medicare, what you don't know can cost you. She has a wealth of experience in this area, and I know that you're going to enjoy listening to her, and you're going to learn a lot of things you didn't know. That's my experience in listening to Dianne. So Dianne is a certified medical bill compliance specialist. She's spent years helping clients from all over the United States with medical billing and insurance negotiation. And Dianne has quite a unique background in healthcare. She serves as principal advocate for Independent Patient Advocates, LLC. In addition, she's a holistic health practitioner. She's worked clinically as a medical and cardiac sonographer and has consulted on computerized medical systems. She considers her first calling health advocacy for others. She honed her advocacy skills from caring for many members of her large extended Native American family of over 100 people, where there's strong cultural values to share your specific gifts and knowledge freely within your community. She's known for her gentle, calming approach and helping clients with anxiety reduction, which is often needed with clients stressed by medical bills. Today, Dianne is going to share some great examples with you on how she saved individual clients tens of thousands of dollars on their out-of-pocket medical bills. She's extremely knowledgeable about the ins and outs of Medicare and loves to share that. And we'll do that with you today. So she'll walk you through what you need to know about Medicare, picking a plan that works, and the pitfalls to avoid. So I'd like to make just a few logistics comments. First of all, you'll all receive a PDF version of the speaker's slides, so don't worry about taking detailed notes because there's a lot of specific details. Second, we are recording this talk so that we will be able to post it to washa.org in about a week or so. So because of the recording, participants are muted and there's a slight delay in receiving your questions. So there's a chat box probably to the right of your screen, so please type in your questions, and I'd like to request that you do that during the presentation so that they're there when we're ready for the question and answer period at the very end. And the speaker will also remind you to get your questions posted. And any questions that we're unable to get to, we'll address in a follow-up email. So at this time, I want to welcome Dianne, and I'm going to pass the mic over to you. And thank you so much for sharing your wisdom with us today, Dianne.
Today we're going to talk about understanding Medicare coverage. What you don't know will cost you. If you've ever signed up for Medicare or helped someone else, you know that the process is much more complicated than you ever dreamed. Today I'm going to try to help you wade through the Medicare mire without getting completely covered in mud. And hopefully we'll help you save some money in the process. I'll explain how Medicare works and how much it costs, and I'll help you understand how to decipher which plans to sign up for that will work to your best advantage and ultimately cost the least amount of money from your pocket. This will all be explained with you as a Medicare patient in mind. I hope that I'll leave you with a more informed process for figuring out how to best get the best plan possible for you. Did you know that Medicare has different parts to it? Each part plays a different role in how much your medical care will cost you. Probably the most important thing we should know about Medicare is to make sure that you have parts A, B, C, and D. Part A is granted to everyone at age 65 and it doesn't have a premium cost. Parts B, C, and D usually have to be initiated by each person and there's a premium for each part. It's unfortunate that there's such a cost for our Medicare when we reach 65 because we've been paying into it all of our working lives. But we have to continue to pay into it with premiums throughout our retirement years. Many people aren't aware of this continued cost, and for some people, it can amount to a large portion of what they would otherwise receive for Social Security, but it can easily be ruinous not to have this coverage. What are the different parts and what are they for? Part A covers hospital or skilled nursing facility inpatients only. This is the portion of Medicare that virtually everyone gets when they're 65 years old or older. There's no premium that you pay for this. It's been paid during your working life by you and your employer. This covers hospital charges for room, incidentals, most nursing care, and pharmacy items while you're an inpatient. In other words, it covers most things that you're billed by the hospital for. It also covers hospice and home health services. Part A pays claims differently than the insurances that most people are used to. They use benefit periods instead of the calendar year for their deductibles. If you're hospitalized as an inpatient, you'll pay a $1,260 deductible, and Medicare generally pays the rest of the hospital charges. The benefit period for a hospital stay lasts for 60 days after you're discharged from the hospital or skilled nursing facility. So this means that if you're hospitalized again within that 60 days for anything related, then you don't have to pay another deductible. But what this also means is that you could pay that $1,260 deductible several times in a year if you were hospitalized again after those 60 days have passed. I had a client who was hospitalized 6 times in one calendar year. He ended up paying 2 deductibles because for his first 3 admissions, he was never out of a skilled nursing facility or a hospital for more than 60 days between admissions. But the 4th time he was admitted, it had been over 60 days, so he paid a second $1,260 deductible. And his subsequent 2 times, he didn't have to pay again because the next one was 45 days later, and the one after that was 2 weeks after. The costs for Part A as a hospital inpatient are outlined in this chart. Most people, if you look at this, most people won't be hospitalized more than 60 days, so your coinsurance for most hospital stays is nothing. If you look at the same kind of chart for a skilled nursing facility inpatient, you can see that after 20 days, your costs start going up. Let's say you have an elder that has a stroke, which affects their mobility on the right side, their ability to speak, and their swallowing skills. They're an inpatient for 6 days, and then they're transferred and admitted to a skilled nursing facility where they receive some intensive physical and occupational therapy that helps them regain their capabilities. So they go home to their family after 35 days in the skilled nursing facility. So for that admission, their Part A costs would be the $1,260 deductible plus a coinsurance per day for days 21 through 35 that they were in the skilled nursing facility. So that hospital and skilled nursing facility stay would cost them $157 a day times 15, plus their $1,260 deductible, they'd leave that entire stay with about $3,600 worth of Part A costs owed. Of course, if you are an inpatient in a hospital and you don't go to a skilled nursing facility, it seems like you would just get a bill for $1,260, right? Wrong. That's only for Medicare Part A. Medicare Part B also gets involved in an inpatient bill. Part B charges for inpatients are usually non-hospital services that are provided in a hospital. So let's examine Part B. Medicare Part B covers medical providers. That's your physicians and your therapists. It also covers medical imaging tests, lab tests, ambulance rides, durable medical equipment. That's things like wheelchairs, and certain kinds of nursing fees. Most of these things are billed separately from the hospital. So when you go in the hospital, you don't just get a hospital bill. You get bills from all of these different things. So you can see from this list that you can get Part B services as an inpatient or as an outpatient in a doctor's office or a clinic. Part B also covers some drugs, but only the ones that are usually not self-administered, like infusions or injections, or some of the drugs that you use with durable medical equipments, like nebulizers. It also covers chemotherapy drugs and tube feeding nutrition. Part B costs most people $104.90 a month, which is taken out of your Social Security check. Yeah, you have to pay Medicare Part B premiums after you're 65 and for the rest of your life. There's one deductible for per calendar year of $147, and you're also responsible for paying 20% of the approved Medicare amount for your Part B services. So let's examine the case of a patient who was an inpatient for 6 days and then went to a skilled nursing facility for another week. While they were in the hospital, they had 3 separate physicians that saw them every day, plus they had some medical imaging tests, and they also received charges from physicians that interpreted and reported on their images. Then, while they were in the skilled nursing facility, they also had a physician and some therapists evaluate and treat them. So all these bills together amounted to a Medicare approved amount of about $10,000. So in this case, Medicare would pay 80% or $8,000, but the patient is responsible for $2,000 plus their Part B deductible for the year, which is $147. So now you're probably thinking, this is really a lot of money out of pocket for someone who's retired and on a fixed income. Yes, it is. And that's where Medicare Part C comes in. Medicare Part C plans come in 2 basic types. They're either Medicare Advantage plans, which are essentially HMOs or PPOs that you engage for all of your care, replacing Medicare Part A and B, or they're what is called a Medigap policy, which helps you pay your 20% copays and deductibles for both Part A and B. The Medicare Advantage plans and the Medigap policies work in very different ways from each other. First, we'll talk about the Part C Medicare Advantage plans. If you choose a Medicare Advantage plan, then you are technically opting out of regular Medicare, and you're taking a private insurance instead. You're still a Medicare patient, but now you have different rules to follow. When you sign up for Medicare Advantage plans, The plan administers all Medicare payments. So what this means, all medical payments. What this means to you is that your medical insurance for both Parts A and B comes through your Advantage plan. The Medicare Advantage plan insurance companies are contracted to Medicare on a per patient, per month basis. Most people don't really understand how these plans work. The coverages are different for each Medicare Advantage plan. So you're actually dealing with an insurance company, not Medicare. Even though this is the case, the Medicare Advantage plans must follow strict rules for coverage to comply with Medicare. So those laws should protect you to a certain extent. But beyond that framework, Medicare Advantage plans are allowed to make their own rules. You evaluate Medicare Advantage plans the same way you would for any health insurance policy like you've had all of your life. Most Medicare Advantage plans are preferred provider organizations or health maintenance organizations. Usually you're referred to as PPOs and HMOs. Advantage plans have the same kind of in-network and out-of-network rules as any other insurance company. You have to see providers and use hospitals and skilled nursing facilities within their network. If you go out of network for care, you might end up paying the full bill. Now, I want you to think about this carefully, because if you want to see a certain specialist or physician and they're out of network, you may have a very large bill or a series of large bills which your plan will not pay. This is a really common problem that I see in my practice, where people really want to see, they get some diagnosis and they want to see the specialist that specializes in their particular problem, but they're out of their preferred provider network. For Part C Medicare Advantage plans, you still need to pay your Part B premium of $104.90 a month. Plus, you pay your Advantage plan premium. The premium that you're going to pay depends on your choice of plan, and there's lots of them to choose from. They're all private insurance companies that have been approved by Medicare. The costs in most of Washington state for these plans are between $55 and $85 a month above your Part B premium. You also have to pay whatever copays and percentages that the plan sets up. Copays can range from between $10 and $275 for each visit. And you're responsible also for the 20% of services and equipment that don't have set copays. So an example of this would be the monthly rental charge for a wheelchair. So if the charge was $150, you'd have to pay $20 a month for your wheelchair. Now remember, I said there are two kinds of Part C types. The second kind of Medicare Part C are Medigap policies, and they're also known as Medicare supplements. These policies work with original Medicare. So you can go to any Medicare provider, even specialists, hospitals, and skilled nursing facilities. This is a really important distinction from Medicare Advantage plans. You can pick your provider. So if you want a second or a third opinion, you're not limited to your plan's network physicians. Medigap plans help you pay for your portion of your medical bills for Medicare Parts A and B, such as your deductibles and your 20% Part B co-insurances. The premiums for Medigap plans vary according to how much you want them to help you pay. There are different companies that sell the plans, but these plans themselves are standardized. So, for example, if one company sells a Plan F, then the Plan F for the next company will have the exact same coverage. So it makes that a little bit easier to go through. The most comprehensive Medigap plan, which is called Plan F, costs about $190 a month, plus your $104.90 a month that you pay for your Part B premium. But with that Plan F, you get virtually no bills for Medicare covered care, not even deductibles. This is a chart that shows the percentages that Medigap plans help you pay for what you're responsible for after Medicare pays your bills. As you can see, these plans can be quite comprehensive in their coverage. If you look here at Plan A, it will pay your Part A coinsurance and hospital costs, even after Medicare would stop paying. It will pay all of your Part B coinsurance and copays, blood transfusions, and Part A hospice coinsurances. Now, if you look over at Plan F, which is the most comprehensive one on this chart, it additionally covers your skilled nursing coinsurance. Remember that $157 a day? Your Part A and B deductibles, and it covers some emergency care in foreign countries. And then, of course, you have all these other plans that will offer somewhere in between this A and F. And the premium that you pay will be reflected in what their coverage is. So how do you choose whether you want a Part C Medicare Advantage plan or a Part C Medigap plan? One of the main reasons that elders choose a Part C Advantage plan is that some of them have lower premiums than Part C Medigap policies. Some Medicare Advantage plans include coverage for your prescriptions, so you don't need a Part D, which we'll talk about in a couple of minutes. Some of them also offer some extras that original Medicare doesn't pay for, such as some limited costs for dental procedures, hearing aids, and eyeglasses, and the exams to be fitted for those. But be careful when you make these choices. Are your medical care providers part of the plan's network? Is the care you will need provided in the plan's regional network? Because all of these have regional networks, such as they may only cover your county. Do you travel outside of that network or live in more than one place during the year? Do you visit your children for extended periods? Or maybe you're one of the snowbirds that go south during the winter and come back in the summer. If you do travel a bit, then you will not be covered outside of your regional network for anything other than true emergencies. Advantage plans also have copays for each visit. The plan can make their own rules about access to care, so you may have to pay a copay for seeing your primary care provider, plus another copay for your specialist visit, because you'll need to get a referral first. And of course, you're still responsible for the 20% of many services that is the Medicare coinsurance. One of the main reasons you may decide on a Medigap supplement plan is that you can choose from any Medicare provider for your care. So you don't need referrals to specialists. If you travel, live, or make extended visits elsewhere, you're covered everywhere in the United States because there are no regional restrictions. Because the Medigap plans are supplements, you may not have to pay more than your monthly premium for covered medical costs. The main reason that people don't choose Medigap plans is that the monthly premium is higher, almost always. But think about this carefully, because only one hospital admission will pay for the extra premium for an entire year. And your copays and other responsibilities under the alternative Medicare Advantage plans can cost much more than the extra in premium for Medigap plans. Another downside is that there are no extras in Medigaps, such as the limited coverage that Medicare Advantage plans give you for some vision and dental and hearing aids. Part D is the final part of Medicare. Part D helps you pay for prescription drugs when you're not an inpatient in a hospital or a covered nursing facility. These plans are really a bear to understand because of the convoluted legislation that governs them. These are also offered by Medicare-approved private insurance companies, just like the Part C Advantage and Medigap plans. So you evaluate them in the same way you do any insurance plan. Generally, you have a drug copay of between $1 and $85 per prescription. Or, depending on the medication, you may have to pay up to 33% of the cost of each prescription. The higher costs are generally for prescriptions that don't have generic equivalents available. So if you have a brand new drug that's out on the market, and it hasn't been out long enough for people to legally make generics for it, you may end up paying really a lot of money for that. The higher costs, most companies that offer Medicare Part D premiums plans have some sort of online interactive, which you can use to find out what you would expect to pay for your medicines with their plan, and if your medicines are covered by their plan, because each plan doesn't necessarily cover the medications that you take. And really, if this was all you had to consider, it'd be pretty straightforward, but unfortunately, there are complications for Medicare Part D. If you use really expensive medications, such as if you have to use insulin pens for diabetes, you may get to a point where you're in the coverage gap, or that donut hole that you hear about. After you and the plan together spend $3,310 in a year, you're in the coverage gap. And you start paying more for your medicines, up to 65% of the cost of each medication. Then, after you personally have paid $4,700 in a year for your prescriptions, your costs will go back down because you're on the other side of the donut hole. The premiums for Medicare Part D are generally about $30 to $50 per month or so. And but as you can see, the Part D plans really leave a lot of room for improvement, because patients can end up paying thousands of dollars every year for prescriptions, even with this Part D insurance. Unfortunately, there really are no alternative Medicare offerings for prescriptions. You can get help with these costs, though. The help you get sometimes depends on your income level, and sometimes it just depends on who you ask for help. The best people to ask are your state insurance commissioner's office, or find an independent patient advocate, and either one will be able to give you individualized help with this. Now let's talk a little bit about actually enrolling in Medicare. For the enrollment process, you have to do some things on time, or it will cost you a lot of money later. First, you need Parts A and B. If you already receive Social Security benefits, you'll automatically be signed up for Part A. But most people should count on applying for Part A and B at their local Social Security office or online. Yes, I did say Social Security. I know that this is confusing because we're talking about Medicare. But Social Security handles the enrollment process, and then Medicare handles paying the medical bills. So you have 3 months before your 65th birthday, the month of your birthday, and 3 months after your 65th birthday. So it's 7 months altogether to sign up. So if your birthday was in mid-November, you would sign up for Medicare sometime between August 1st and February 28th. So the 3 months before would be August, September, and October, and then your birth month of November, and then the 3 months after, December, January, and February. Most people should sign up for both Parts A and B unless they're still working and have creditable coverage through their employer. If this is the case, always call Medicare and make sure that your employer plan is creditable coverage, because if you don't sign up for Part B in the correct time period, you will pay a higher premium every month for the rest of your life when you do get Part B. Now think about this very carefully, because if you delay getting Part B for 5 years, the premium will be 50% higher, 10% for each year of delay. And another important thing to consider is that if you sign up for Part B later, unless you're eligible for a special enrollment period, you'll only be able to sign up during the Part B general enrollment period, which is yearly between January 1st and March 31st. And then your coverage doesn't start until July of that year. And you can rack up a huge debt in that amount of time if you have a medical crisis. Special enrollment periods are special times that you may be able to sign up for Parts B, C, or D. These are so specialized that really you need to talk to a professional about them. You can call Medicare to find out if you qualify for one, or you can call a healthcare advocate for help. After you've enrolled in Medicare Parts A and B, you have choices to make. The first choice is whether you'll decide on original Medicare or a Medicare Advantage plan. This choice can be difficult, but really it boils down to one real question. Would you rather pay a mostly predictable amount every month, or would you rather pay as you go for the services that you end up needing, even though those costs are not predictable? Either way, you should enroll during the 6 months after you turn 65 and enroll in Part B, preferably at the same time as you enroll in Parts A and B. Doing this will ensure that you get the plan you want with the lowest premium possible, because if you sign up on time, the plans cannot refuse to cover you because of your health status, and everyone pays the same amount for the coverage. This is even if you have very, very poor health. If you choose to sign up for a Medicare Advantage plan, you should know that most Advantage plans include the Part D prescription coverage. Pay close attention to how much copays and percentages are that you have to pay with each plan. Make sure your healthcare providers are on the plan. And just like if you were looking at a separate Part D plan, check how much your prescriptions will cost. So for those choosing original Medicare, you should get a Medigap policy to help you with your costs. Choose the one that makes the most sense to your individual situation. The same is true for your Part D policy. The policy that's good for your next door neighbor may not be right for you. Check the covered drug list for the medications that you take. Make a list of your medications. Go to the insurance company's website and put in each medication and find out how much each one will cost you, and how much and whether those medications are covered or not. Those interactive websites really help a lot. So what if you decide you're already signed up for Medicare, you decide you don't like your Medicare choices? It may not be too late to change them. If you have a Medicare Advantage plan and you've had it for less than a year, you have guaranteed issue rights to change to a Medigap supplement. If your Medicare Advantage plan makes changes to things such as their regional care, you may be able to change plans without any penalties. So there are some exceptions to the rule. There's a lot of them. But if you don't fall into one of these exceptions, sometimes the new plan can charge you more for your policy due to your health or even refuse to cover you at all. There's also every year there's an open enrollment period from October 15th through December 7th. And during this time, you can change your Medicare Advantage plan or your Part D plan, and the new plan will start on January 1st of the new year. If you don't sign up for Part B, you can't get a Part C policy. This is another reason that's so important to enroll in Parts A, B, C, and D as soon as you're eligible. I had one client who didn't sign up for Part B when he turned 65 because he was still employed and on a health plan. He had a really good insurance. But the problem was that when he did retire, he was already suffering from early stages of dementia, and he couldn't remember how to sign up for Medicare Part B. So he had no coverage. And very quickly, he ran up $85,000 in what would have been Part B covered services. You don't even want to know what his Part A was, but it was covered. Don't let this kind of disaster happen to you. My client was really lucky because I was able to help him, and I saved him most of that $85,000. But if you didn't sign up for Medicare in a timely manner, you may just be in big trouble because you have to wait until the general enrollment period from January 1st through March 31st each year. Your coverage won't start until July 1st. So you might have a significant coverage gap where you have no insurance. Now think about that. You can't sign up for Part C either if you don't have B. So you'd have to, if you signed up for Part B at a late date, let's say you signed up for it in January, your coverage didn't start till July, you also can't sign up for a Part C policy until July. There's a lot of special exceptions to the time periods that you have to enroll in Medicare and all the different plans that are available, but they have very strict rules for each one. And there's really too many of these for me to discuss today, but if you find yourself in this kind of situation, call Medicare or hire a patient advocate to see if they can help you fit into one of these special enrollment periods or help you get your coverage through different means. One last thing that's very, very important for you to understand about Medicare is Medicare does not cover long-term care. What this means to you is that if you get to a point where you need living assistance, but not actual medical assistance, you're on your own to pay for it. So let's say that you can't dress yourself or cook your own meals. I'm talking about assisted living or long-term care, which is commonly called nursing home care. This kind of care can easily cost $7,000 a month and up. And the only way to get help with this kind of cost is from private long-term care insurance, or if you've exhausted all of your resources, Medicaid. This is a sticking point for a lot of people because they just don't realize that it's not covered. If you start into dementia and you get where you can't recall whether you turned on the stove or not, you need some help with your living, but not real nursing care, then you're stuck. In Washington State, if you have computer access, look for SHIBA. It's the Statewide Health Insurance Benefits Advisors. I put their number here on the screen. It's an 800 number, 562-6900. They have events scheduled around the state for in-person counseling for signing up for Medicare. So if you go to their website, you can find a list of those events. You can also go to the Medicare website, medicare.gov. Medicare has lots of really good information on their website, and they have some interactive tools that can help you decide which plans to sign up for. They're a little hard to understand in my thinking. I think that AARP has a better, easiest to understand website and pages. You'll find them at aarpmedicaresupplement.com. You'll find on that website, you'll find a resource center page which has absolutely excellent short videos that explain Medicare. They're 3 or 4 minutes long. There's a whole slew of them, and they explain your individual choices. It also has interactive tools to help you compare the different plans. The next URL listed here will get you to a page that talks about retiree health plans, health insurance, and how they work with Medicare. There are some surprises here. So if you have retiree medical insurance, I would advise you to go to that website and look at some of those things there. And the last website that I have listed there is cms.gov. And that is another Medicare website. CMS stands for the Centers for Medicare and Medicaid Services. So this one will often link you back to the medicare.gov website. And of course, if you need help signing up and you're frustrated trying to get it, hire an independent patient or health advocate, and we'll try to ease your anxiety and lead you through the process. Now, we're going to open up for questions. If you have a question that you haven't submitted yet, you can go ahead and send that in on your chat screen on the right side of your screen. And as Ingrid mentioned, there's a significant delay. So if we don't get to answer it now, we'll send out an answer to your question in a follow-up email. And I'm going to turn the microphone over to Ingrid now.
Thank you, Diane. That was a lot of information, and I'm really glad. I'm just going to emphasize that we are making available your really wonderful slides so that all the details are there. And we do have some questions, and one of the questions was a comment that I'll have you address. And then we have some additional questions that have come through. So one of the comments was, just to clarify, Medigaps are not actually Part C plans because they existed prior to Part C coming into the picture. And they are separate insurance plans to cover copays and deductibles. And Part C is considered solely Medicare replacement plans. And another name is Medicare Choice, or as you mentioned, Medicare Advantage. So I wanted you to comment if there was any clarification you wanted to add to that.
Well, that's correct. It's a little easier to explain to people the Medigap versus Medicare Advantage plans the way that I explained it. But Medigap, a lot of people don't consider that a Part C. It is a supplement, as I explained. It pays for your co-pays and your 20% co-insurance amounts.
Okay. And so another question that came in was, does a Medicare beneficiary have a choice between Medicare Advantage plans and Original and Medigap, or does Medicare automatically enroll the beneficiary and the beneficiary must choose to go to a different one?
Medicare doesn't automatically enroll you for anything except Medicare Part A. And it only enrolls you in Medicare Part A if you're already receiving Social Security, because then you're already in their system in that manner. You have, for Medicare Part B, the Medigap policies, the Medicare Advantage policies, and the Part D policies, you have to sign up for those. Nobody automatically signs you up.
Okay, well, that answers that. Another question we received, when you talk about what is covered by Medicare, you spoke mostly about elders. But if one has Medicare because they're receiving disability insurance benefits, are the charges different? Like,
If you're talking about the charges for the premiums, a lot of times if you're on Medicare because you're disabled, a lot of times you also qualify for Medicaid, and so you essentially won't, if you're qualify, if your income is low enough, you qualify for Medicaid, you don't pay any premiums. They're paid for you by state, federal Medicaid programs.
okay. And I also have a question about the Affordable Care Act and the donut hole. And what is your understanding about eliminating that coverage gap that you described, where you pay up to $3,300 and then you're in the gap? Did the Affordable Care Act address that, or do we still have this coverage gap before you approach that $4,700 of out-of-pocket expenses?
You still have the coverage gap. What the Affordable Care Act did for us in that regard is there is a step decrease in the amount that you pay out of pocket for the coverage gap. It goes down every year for several years, but it doesn't go away. So the amount that you paid this year, the maximum amount, will be less than it was last year. And next year it will be less, but it's still there.
Okay. Thanks for clarifying that. Another question I have is about when you've been denied services and want to do an appeal. Do you appeal within the insurance plan? That is, if you have a Medicare Advantage plan, or do you appeal directly to Medicare?
Well, that one is sort of up to you. Every one of the Medicare Advantage plans have an appeal process. They have to by law. And it's part of how they qualify to be an approved Medicare plan. So they all have an approved appeal process that you can go through. You also can appeal to Medicare. Personally, I would try the Advantage Plans appeal process if you feel like you're not getting anywhere, you can always default over to the Medicare process.
Okay, thank you. Another question is about the special enrollment period. How does that differ from general Medicare enrollment?
Special enrollment periods, there's a whole bunch of them. Let's say you have Medicare Part A and B, but you don't have an Advantage plan or a Medigap policy. There are certain times that you can go ahead and enroll in those. Like if you were admitted to a skilled nursing facility, there's a certain amount of time that you have to apply and get a Medicare Advantage plan. I'm not quite sure whether you can get a Medigap. Medigaps are harder to get. Medigap plans are such a good deal that they're not offered as freely as the Medicare Advantage plans are. You have to have very, very specific time periods to get into them. But let's do a different kind of special enrollment period. So let's go back to our elder that decides they're still working and they have really good medical insurance and they don't want Part B when they turn 65. So they get Part A but not Part B or C or D. And then their job ends. So they lose their group plan from their employer. They have a special enrollment period where they can apply, sign up for Medicare Part B, C, and D. So there are a whole bunch of them. There's a big long list of them, and but they all have very, very, very specific rules. So the best way to do that is you can go on the Medicare or the CMS website and look at the special enrollment list there and see if you might qualify for one of those. But the best way to do it is to ask Medicare or find a patient advocate that you can ask.
Okay, thanks, Diane. I've gotten some feedback that there's some distracting noise, probably with the microphone back and forth exchange. So we are hoping we have addressed that. And I have another question that's come in that says, can you sign up for Part B online?
I believe so. Yeah. You can sign up for just about anything online. It's a lot easier than if you qualify. If you're in a special enrollment period or your initial enrollment period, you can do it. A harder way to do it is to go down to a Social Security office and sign up there. Social Security, it's a little confusing to people because Social Security always handles the enrollment process for Medicare. So if you're signing up for Medicare Part B, you can go down to the local Social Security office and fill out paperwork with them or have it filled out and bring it to them. Sometimes that's it's a little tedious. You can sit in a Social Security office for quite some time before you get called in. I would prefer to do it online.
Okay, thank you for that, Diane. We have, it looks like one final question that has come in. And the question is, if someone's choosing original Medicare, should they also choose their Medigap plan right away or within a certain time period?
Well, you have 6 months after you sign up for Part B to get your Medigap policy. And during those 6 months, if you sign up, they cannot refuse to cover you. They cannot give you a higher premium. So even if you have really, really bad health and you have lots of chronic diseases, or you can even be in the hospital, you can still sign up for a Medigap policy during those 6 months. If you wait longer than that, it's very difficult.
Okay, thank you so much, Diane. We are going to wrap up. And again, I'm going to remind people that you are going to have a full version of these slides, which Diane has made available to you. And we really appreciate that, Diane. It's a great resource. And the web links you provided are really helpful for backup as well. And we will, if there was any feedback in hearing some of the answers, we'll make sure that all of the answers are written out as well to the questions that you all submitted. And we sure appreciate your interaction with us this morning. And at this time, I'm going to sign off, but I do want to remind you of a few things. We have our first two webinars still online at washa.org. And if you're a nurse or social worker, you can receive continuing education credit if you're interested. And those webinars, the first one was on the Death with Dignity Act for Washington State, and the second one was on misdiagnosis. And they're both excellent presentations. If you want more information, please visit our website. Also, we have WASHA's third annual meeting coming up November 13th in Seattle. We're very excited about that, and we hope that we might see you there. For further details, again, go to our website. And as we close this webinar, you're going to be redirected to a post-event survey. If you have to leave right away, we'll send you the link in an email. But we really would appreciate your feedback. We're continuing to develop this webinar series. And we also want to know what you want to hear about, what topics are of interest to you. So with that, I thank you all for taking the time. I really thank Dianne Walkup for answering a very complicated process. And I'm sure that we all have a good place to start and good resources to answer some questions should they come up after today. So thank you so much for attending, and everybody have a great day.